Like many of you, I enjoy a good meal. I love going out to eat and having great service and great food in a really nice environment. How many of our patients love to come to the dental office? Well, some of mine actually do, especially our retired patients. And more than often, I often hear a patient say to me, I can't believe it, but I love coming to your office. It's not loving getting a restoration or getting an injection, but they like the experience that they have when they come in. And in previous posts, I've talked about the importance of running your dental office like a really fine restaurant. Now, there is a difference between service and hospitality. Service is providing the bare minimum. It's what's expected. When someone comes to your dental office, they expect you to do a good diagnosis. They expect you to give them a treatment plan. They expect you not to hurt them. They expect it to look reasonably well. That is not the same thing as being hospitable. Being hospitable is having a clean, neat office, having nice music being piped in, having a selection of magazines, having the patient being greeted by name, even if it's their first visit, because we've gone onto Google, Googled the patient, found out what they look like, and when they walk in the door, we know who they are. Hello, Mr. Jones. Can't wait to see you. Have a seat. Can we get you a cup of coffee or a glass of tea or some water? We even have a little bit of a menu in our reception area now, and that is post-COVID, giving patients a selection of drinks and various refreshments that they can have when they're sitting there. And if someone has to wait because their spouse is going through a longer procedure, maybe they're having some surgery, would you like to wait in a private room? We have Wi-Fi for you. You can do your work there as you wait. We can get you something to drink. It's an over-the-top experience for that patient. So when patients come in, we want to give them more than just service. We want to give them a hospitable environment where they feel comfortable, where they feel well treated, and in short, where they feel very special and loved. We want to take away all their fear, all their apprehension. We want to take away anything negative that they may feel because they're in a dental office. Now, it's not easy for a lot of us to do that. I was just visiting my mentor in Atlanta, and one of my colleagues happened to be there, who's an oral surgeon. He's probably one of the top oral surgeons that I know in Atlanta. He says, I love doing oral surgery. He still has a tremendous amount of passion because I wish I could just go into the operating room and do the surgery. I go, you can. I go, but you're not going to give the patients the same experience. You can't ask your team to do what you're not willing to do. If you are a doctor, if you're a leader, you have to provide an over-the-top level of customer service and hospitality for your patients if you expect your team to do so. On my days off, I'm frequently walking around the area looking if the light bulbs are out, picking up trash, making sure the office is clean, everything's organized. You can open up any door in our office and it is neat, clean, and organized. And I ask my team members to do the same for their private areas. So if you come to my office, everything is going to be neat and clean. Perfect. You can eat off the floors. We want to give our patients that kind of experience where they feel, wow, I'm safe, it's neat, it's clean, they're treating me well. How many restaurants do you go to where you feel, wow, I'm getting a great experience here? Very few. There are very few. There was one of my favorite restaurants in town. It was called Pasta Nostra. It's no longer in business. And after about 40 years in business, Joe, my friend, finally closed the doors. It was my favorite restaurant. There is not a restaurant in town that has taken its place. You know what that means? It means that there's a void. If you want to give over-the-top customer service and be phenomenal at what you do, be a great dentist, have a great team around you, you can be the most successful person in your town. Do you know why? Because very few people are willing to go to that level. My mentor Dan Sullivan says that there's no competition in a niche. And there really isn't. If you practice with high integrity and do everything as best to your ability as possible, you don't have to be the best dentist, but you could be the most motivated dentist, the kind of dentist that shows up every day. Like my friend Kerry Oberrenner, my publisher, says, and he's written a book about it. He goes, you want to show up filled up. If you show up every day for passion for what you do, and you demand that everybody on your team does the same thing, you're going to have a phenomenal practice. You're going to be booked 3 to 4 months in advance. You're going to have patients lined up outside your door waiting to get in, just like a fine restaurant. There are some restaurants in New York City that are booked up. There's no tables. And they book up a month or 2 months in advance. And let's say today happens to be Monday. So Monday, they're going to open up their book. and they're going to open up the next month. And if you don't call between 8 and 8:05, you're not going to be able to get in the next month because that's how busy they are and that's how they fill up. Is the food that good? Come on. I mean, food is food. We've had plenty of meals. The food can't be that good, but the experience is that good that people want to go there and tell other people about it. Now, how many restaurants stay at that level where you can't get in for 10, 15, 20 years? There aren't too many that maintain that level. My mentor, Danny Meyer, who owns 30, 40 restaurants in New York City as well as Shake Shack, his restaurants are booked up like that. Why? Because for the last 40 years, he's maintained that level. He's maintained that level of quality, that level of excellence, that commitment to always keeping his restaurants at that high-end level. And they're always full. When I go to Union Square Cafe, which opened in 1985, the same year that my office opened, I have a same great meal that I had there 30 or 40 years ago. It's great. And if it's not great, I'm always surprised. And if I say something, if something's a little late, guess what happens? I get an email from the maitre d' or from the general manager saying, I'm sorry that you had to wait last time. Come in next time on us. They still go over the top. They rewrite their story. They rewrite the ending to their story because they don't want anybody to be dissatisfied. We are in what we call the cancel culture now. We talk about that a lot. Or if things aren't done a certain way, we say someone's canceled. Well, there's another type of canceling that we never talk about. I call it quiet canceling. What quiet canceling is when someone doesn't say anything, they don't complain, they just walk away. And it happens all the time, and we're not aware of it. So when patients don't come back to our practice, they don't call us up and yell and scream. I wish they did because then we can remedy it. Most of the time, they just don't come back. They may not even be aware that they're not coming back. They just may not be interested. How many of our patients come back every 3 to 4 to 5 months for years, for 30 years, to take care of their mouths because we recommend it? Not that many. Not that many. What percentage? About 15%. That's what the data shows us. So, do your best. Always show up. Show up, like Carrie Elberbenner says, filled up. Give patients an over-the-top experience. I'll tell you something. You know what the greatest gift is for me? The greatest gift for me is being a gift to others. Nothing makes me feel better than when I am there for somebody else. I think you'll feel the same way as I do. I mean, almost all of us do. Opening up a gift is never as good as giving a gift. They say giving is better than receiving, and people say, well, no, I'd rather receive. It's not true. The happiest people are the ones that are most giving. And we are in a great position as healthcare providers. We get to give all day long, and we get paid for it. And they respect us for it if we do a good job. So my suggestion to you all, because it's worked well for me over the last 40 years, is continue to be the gift, which I'm sure many of you are already. Have a great day, everybody.